Hello, friends. Can you hear me? Can you hear me? Hello, Akshay. Is the audio clear? Is the video clear? Great, great. Is the audio clear? Is the video clear? So nice to see all of you actively present. As you know, in this crisis period, we have started the emergency classes for you all so that you don't waste time and you can make the best use of your time. So nice all of you actively present. As you know, in this crisis period, we have started the emergency classes for you all so that you don't waste time and you can make the best use of your time. So I'll just wait for a few more minutes for more of you to join, and then we can begin our session. Okay. I'll just wait for a few more minutes for more of you to join, and then we can begin our session. In the meantime, I'll like to talk about the biochemistry as a subject for your NEET exam, and I'll also talk a little bit about how it will help you in the oncoming next exam, which will be applicable most probably from 2022. In the meantime, I'll like to talk about biochemistry as a subject for your NEET exam, and okay, Akshay, I got your complaint. Actually, my phone was also receiving the YouTube feedback, and I think the echo was coming in from there. I think you should not get the echo any longer. Is the echo still there? Is the echo still there? Okay, I hope the echo has gone now. Great, great. I have put my phone on mute so that the echo is no longer there. So before I start biochemistry, I'll tell you a little bit about myself. I am Dr. Nilesh Chandra. I've done my MBBS from Maulana Azad Medical College, Delhi, and I have done my MD biochemistry from University College of Medical Sciences, that is also in Delhi. After that, I've worked for 4 more years as a senior resident at the University College of Medical Sciences. I was assistant professor at Subharti Medical College, and now I am full time in teaching. I have been teaching for almost more than 8 years now. I started teaching in 2012, and I have taken classes all over India. Rather, I would say I've taken classes all over the world to help our students to overcome this barrier of the examination. Whether it is a foreign medical graduate, I have been to China, I've been to Kyrgyzstan, I've been to Crimea, I've been to Ukraine. I'm scheduled to go to Russia also to take the classes for the foreign medical graduates, and I have been taking classes for our PG students. I have taught at almost all the institutes at one time or the another. Currently I'm also teaching at the Dr. Bhatia Medical Institute. Previously I have taught at IAMS. I've also taught at PGDIMS. So I have taught at a large number of institutes. Currently I'm active at various institutes. Some of you might have seen my page previously. online. I maintain a separate page for biochemistry by the name Biochemistry by Dr. Nilesh Chandra. We have more than 5,000 students actively present on this site, and obviously, if you need, you can access me via the PGIMS platform. Dr. Manoj is very active on that platform for you students, and we are always available to you through the PGIMS platform. Okay, just one last important feedback. Is the audio clear and is the video clear? You should focus on the screen part that is coming to you rather than my video. Even if my video is a bit blurry, it should not matter much. But the screen part which is on your screens, that should be clear. The iPad which is being reflected on your screen, that is the part which you should make sure it is clear. So just give me a thumbs up if the audio is clear and you can clearly see the screen on your own mobiles or whatever device you're using. Great, great. So that's so nice. That's so nice that everyone is able to get the things clearly. So now I'll talk a little bit about biochemistry in general as a subject for your PG entrance exam, and then we will go into the subject. All right. So, first of all, I'm sure that most of you have not had a very good experience with biochemistry in your undergraduate years. And believe me, it is the most common complaint that I get from most of our students that we just brushed through biochemistry. We read only what was required for passing. We read it just before the exam, went to exam, regurgitated everything, and then we have forgotten biochemistry. By the time we are interns or post interns, everyone has mostly washed their hands off biochemistry. Biochemistry is a distant dream, and nobody is in touch with biochemistry. But believe me, this is same for everyone. There will be very few diligent students who have taken out time to read biochemistry in the intervening years, but till now there has been very little overlap with biochemistry, and as a result the preparation in the biochemistry suffers a lot. This is where I come into the picture. Now, when we are dealing with biochemistry, we'll approach it from the grounds up. We'll first quickly revise your basics so that you don't feel lost. Once you have captured the basics, then we'll slightly build it up. Please note that the questions get asked from the basics as well as the applied part. So if you are not clear about the basics and if you only do the questions, then handling the applied part will become difficult if you get a new question. So basics should be very clear. If your basics are clear, you can handle any type of applied part which comes in the exam. That is first point that we have to keep in mind. All right. Okay, so we will start from the basics. So even if you have totally forgotten your biochemistry, it doesn't matter. We'll go from the very fundamental aspect and we'll gradually build it up to the level which is required from you for the PG entrance exam. Please understand that for any of the 19 subjects that you are studying, there is no end to the study material, but we have limited time and we have to prepare our subject in this limited time in such a manner that we can answer all the questions coming in the exam. So our goal should be clear. We are studying and focusing on our syllabus so that we can answer all the questions coming in our PG entrance exam. That is how we are designing our classes. We start with the basics and then we gradually build it up to the applied parts and focus on those topics which are very frequently asked in your exam so that you can score good marks in your PG entrance and you can successfully uh, you can successfully you can successfully uh, uh, answer all the questions in the exam. Okay, so uh, that was one. And number two, I would say second thing, that for the NEET exam, there are very clear cut topics which are in the focus, and they tend to be topics in which either lot of ongoing research is there, or topics for which a very significant clinical application is there. So if you are revising a topic, just try to answer these questions. Is it applicable for ongoing research, or is it applicable clinically? If any of the answers is yes, then it is a very important topic, because the examiner will generally not ask you what is the ongoing research in detail, but the examiner will expect that you know the basics of that topic from which the ongoing research is there. So with this, with these two parameters, we are able to quickly decide which are the very important topics. Now, in the next scenario, gradually more and more applied aspect of the biochemistry is going to come, but the biochemistry is going to become more and more important, because if you see around, you will realize that more and more tests in the lab are based on biochemistry. Even now, about 85 to 90% of the investigations that you order as a doctor are from the biochemistry section. All the blood test of the enzymes, of the analytes, of the electrolytes, sugar, everything that you're measuring come under the biochemical aspect. Then we come to the newer molecular techniques. Again, they are covered in the biochemistry. Currently, in the coronavirus, what is the modality for diagnosis? What is the accepted investigation? It is the real-time reverse transcription PCR, which is a biochemical technique. All right. What is the alternate screening methodology? It is based on the antibody reaction, the ELISA, which is a biochemical technique. So the biochemistry is going to become more and more important in the coming days. And at the current scenario also, we have lot of biochemical aspects in all the clinical cases. 5-10 years before, it was not so, but now with the increased use of molecular techniques, biochemistry becomes more and more important. So we have to take care of that. Okay, so today I'll be starting from a very simple topic, well known topic, that is carbohydrates, so that you are able to revise and be familiar with this topic very quickly. So we are going to be talking about carbohydrates today. All right, so the first topic that we pick up is the carbohydrates. Please feel free to send across your questions to me under the comment section. I have opened up a, uh, live review, so I can see your comments and I can take up those doubts or questions from the comment section. If you have any doubts, any confusion, any query, you are most welcome to quickly send a comment in our chat section. All right. So let's talk about carbohydrates. What do you mean by carbohydrates? Anyone? Divya, Gokul, anyone? What do you mean by carbohydrates? What are carbohydrates? Normally we write the formula as CnH2ON. So how do you describe this? Carbohydrates are, in very simple words, hydrates of carbon. So in this way, you are able to remember the simple formula for carbohydrates. In addition to this, you should also know how to describe the carbohydrates biochemically. So here you have to remember two important features in the carbohydrates. They will have a very important functional group, which is either aldehyde or the keto group. One aspect is an aldehyde or a keto group is present, and second aspect is polyhydroxy molecule. So how we describe the carbohydrates is aldehyde or ketone derivative of polyhydroxy molecules. So aldehyde or ketone derivative of polyhydroxy molecules, that is how we describe the carbohydrates. That is how we describe the carbohydrates. Now, carbohydrates is one of the three important macromolecules coming in from our diet, which is required for the well-being of the individual. So, once we know the definition of the carbohydrates, we should know how to classify the carbohydrates. So, as you know, the carbohydrates can be broadly divided into three groups. The carbohydrates broadly divided into three groups: monosaccharides, the oligosaccharides, and the polysaccharides. Now, what is the criteria for this classification? The criteria for this classification is very straightforward. It is based on the number of functional groups, that is aldehyde or the keto group. If you have one functional group, that will be the monosaccharide. In oligosaccharide, we have 2 to 9 monosaccharide residues, and polysaccharide we have more than 10 residues. Alright, so basically based on the number of functional groups, that is the aldehyde or the keto group, we describe them as monosaccharide, oligosaccharide, and polysaccharides. Alright, the monosaccharides can be further subdivided. The monosaccharides further subdivided based on number of carbon atoms. The number of carbon atoms varies from 3 to 7. The number of carbon atoms varies from 3 to 7 atoms. Okay, and accordingly we have the terms triose, tetrose, pentose, hexose, and heptose. Okay, so based on number of atoms, we call them triose, tetrose, pentose, hexose, heptose, and based on the functional group, they will either be aldose. In aldose, we have the aldehyde, or they will be ketose. In ketose, we have the keto group as the functional group. So aldoses or ketoses. A very commonly asked question at this point is, which is the simplest aldose, which is the simplest ketose, which is the simplest aldose, and which is the simplest ketose? I'll give you 10 seconds to answer. You can write in the comment section which is the simplest aldose, which is the simplest ketose. You have 10 seconds. Your time starts now. Come on. I'm waiting for your answers. Anyone? Very good, very good. I can see Sheikh Bilkis has given us an answer. Glyceraldehyde. Manohar, glucose is not the correct answer. Glucose not the correct answer. Very good. Sheikh has given the second answer, dihydroxyacetone. That's very good. Okay. So please note, a lot of you have mentioned glucose. I'll quickly highlight that glucose is aldohexose. Glucose is aldohexose. It is not a triose. When we say simplest aldose, simplest ketose, your answer should be a triose. Okay, and the aldose, which is triose, like your friend said, is the glyceraldehyde, and the triose, which is the ketose, is the dihydroxyacetone. Very frequently asked question, you must remember the simplest aldose is the glyceraldehyde. The simplest ketose is the dihydroxyacetone. This is a very basic fundamental question which you have to keep in mind. All right. Okay. So this is about the monosaccharides. We'll talk about the metabolism of monosaccharides, some important properties of the different monosaccharides as we go through the metabolism. All the metabolism. Can you hear me now, Manohar? Can you hear me? Small intestine, and mostly the monosaccharides are allowed to pass through. The oligosaccharides, the polysaccharides cannot directly enter the body. Some polysaccharides can be synthesized in the body, but they are not absorbed from our diet. Okay, Sindhuja will come to your question. The sialic acid part will come to your question. Sialic acid part later. Just hold that question for the moment. The sialic acid question will come to that. Okay. So that was about the monosaccharides. Let's quickly move on to the oligosaccharides. Now I am going to talk a little bit about oligosaccharides. Remember, I said they have 2 to 9 residues. They have 2 to 9 residues, and based on the number of residues, now we are talking about residues means the functional group, or how many aldehyde, how many keto, and based on that, the oligosaccharides can be mentioned as disaccharide, the trisaccharide, and so on and so forth. So on and so forth, they can be mentioned. Among all the oligosaccharides, what you need to know about are the disaccharides, because these are the most commonly and abundantly encountered oligosaccharides. Moreover, there are specific enzymes for the metabolism, or you can say digestion, of the disaccharides in our intestine. Therefore, they become very, very important. Now, when we talk about the disaccharides can be of two very important types. We can distinguish between the disaccharides based on what is known as the Benedict's test. Benedict test is a test which is given positive by reducing substance. Reducing substance means a substance which has certain amount of reactivity, easy reactivity. If it is there, we call it the reducing substance. So based on the Benedict test, we are able to distinguish, or you can say divide, the disaccharides into two. Those who give the Benedict test as positive, we call them reducing, and those who are unable to give a positive Benedict test, we call them non-reducing. So some of the disaccharides are reducing, some of the disaccharides are non-reducing. Very simple. Remember, all monosaccharides will give a positive Benedict test, meaning all monosaccharides are reducing in nature. All monosaccharides are reducing in nature. Okay. So the Benedict test will divide the disaccharides into two, reducing and non-reducing. Some names which you have to remember under the two sections are lactose, maltose, isomaltose, and lactulose. These are some names which you should remember under the heading of the reducing sugar. Under the heading of the non-reducing sugars, the names which you should remember off your hand is number one, sucrose, and number two is the trehalose. These are two names which you have to remember offhand. The sucrose and trehalose are both non-reducing. So what we'll do, we'll quickly mention a few important points about some of them, the lactose, maltose particularly, and a little bit about sucrose also, the points that you should remember. Let's start with lactose. Let's start with lactose. So lactose, okay. So lactose, like we said, is a disaccharide. So you should be able to tell us the two components, which are the two units in lactose. I'll give you 10 seconds. You have to quickly tell me the building block of the lactose, which are the building block of the lactose. Time starts now. Please give us the building block of lactose. Very good. We have got an answer from Murtaza. The building blocks are glucose and galactose. Very good, very good. I'm so happy to see you all quickly answering the glucose and galactose. Glucose and galactose will make up the lactose. All right. The link between glucose and galactose is, wow, wow. I'm so glad to see so many answers jumping in. That's great. That's great. So, how do we describe the bond between glucose and galactose? It will be described as the alpha oblique beta 1 4 glycosidic linkage. Don't worry about the alpha and beta. We'll talk about this alpha and beta later. There is no need to worry about the alpha and beta. I'll describe what is alpha beta. Just focus on the description of the bond. Carbon 1 of the first molecule, carbon 4 of the second molecule is involved in the bond formation. It is involved in the bond formation. Enzyme which helps to break down the lactase. Lactase enzyme is used to break down the molecule lactose. Where is lactase present in the body? Is it present in the muscles? Is it present in the liver? Is it present in the kidney? Is it present in the intestinal cells? Very quickly given the answer, location of the enzyme lactase. Location of the enzyme lactase. Okay, I've got an answer, muscles. Anyone else? Intestine. Anyone else? Anyone else? Great, great. So please remember, I just said a few minutes back that all the oligosaccharides and polysaccharides must be digested in the intestine. So if the lactose has to be digested in the intestine, the enzyme to digest the molecule must be present in the intestine. It is present on the luminal surface, in the cavity of the intestine where the food travels. All right, it is traveling there. Okay, lactose is commonly present in the milk, therefore sometimes also known as milk sugar, commonly known by the name of milk sugar, and sometimes it is used for making medicines because it has a very mild sweet taste. It is used in medicines, it is used as filler in pills. But one very important clinical aspect that you have to remember is, in some individuals there is genetic deficiency of the enzyme lactase. What will be the condition known as genetic deficiency of the enzyme lactase presents as? Please write your answers quickly in the comment box. Genetic deficiency of lactase presents as which clinical scenario? Very good. So answers have started coming in. It is the lactose intolerance. The lactose intolerance. Now, this is a very, very important clinical question, very frequently asked in your exam. Very frequently asked in your exam, the lactose intolerance. I'll mention 2, 3 points about this which you must know and where a lot of confusion is created. Okay. Number one, lactose intolerance means there will be problem in GI system. Please note the problem will be in the GI system. So when I say problem in GI system, what does this mean? It means there will be maybe a diarrhea, there can be a flatulence, there can be abdominal cramps. In severe cases, there may even be vomiting. So please note all the features related to the GI system. All the features related to GI system. In addition to this, we find reducing substance in stool. If the lactose is not digested, we had seen it is a reducing sugar, it will go into the stool and it will give the positive biotic test in the stool. Reducing substance is seen in the stool. So first point to remember, all the sign and symptom will be in the GI system. One of the common questions is in which of the condition the reducing substance is seen in urine, and one of those options is lactose intolerance. So remember, in lactose intolerance, the reducing substance is there in the stool, it is not absorbed in the body, so it cannot appear in the urine. All right, so in lactose intolerance, reducing substance will be there in the stool, not in the urine. That's one. And second, milk products which can be safely consumed. Which are the milk products which can be safely consumed in this clinical scenario? So I'm waiting for your answers. Milk product which can be safely consumed in a patient of lactose intolerance. Milk product which can be safely consumed in a patient of lactose intolerance. Okay, curd. Anyone else? Great, great, great. Very good, very good. That's so nice to hear. So you can consume curd. If curd is not there in the option, you can mark yogurt. If curd and yogurt, both of them are missing from the option, then your third option will be ice cream. Uh, Not cheese. Please note, not cheese, not cheese. But yes, final answer can be ghee, but this will be used as answer only when this is not there, this is not there, this is not there. Ghee is plus minus, ghee is plus minus. We don't have well established studies with ghee for lactose intolerance, but it, because of the amount it is used, it is unlikely to cause the sign and symptom of the lactose intolerance. Vegan milk is not actually a milk product. Vegan milk is a soya bean product. So it doesn't come into the list of milk products which can be consumed safely. Vegan milk is a soybean product, so it is not a milk product. Right. So remember, from the milk, the curd is obtained from the milk, yogurt is obtained from milk, ice cream can be made, but they can be successfully consumed by a patient of lactose intolerance. Reason being, in these, the lactose part has already been digested, or you can say it has been used up. The lactose has been used up, so it is not there, and therefore it doesn't cause the lactose intolerance. Quick recap about lactose. Lactose, the milk sugar, it is made up of glucose and galactose. Remember, it is a reducing substance. The Enzyme for digestion of lactose is lactase. It is present on the luminal surface of the intestinal cells. It is present on the luminal surface of the intestinal cells. In some individuals, there can be genetic deficiency of lactose, giving rise to the condition known as the lactose intolerance. It will cause the lactose intolerance. 2 points, remember, the patient of lactose intolerance will show the sign and symptom in the GI system, meaning you can have the diarrhea and flatulence, abdominal cramps, vomiting, and lastly, you will find reducing substance in the stool. In addition, milk products which can be safely consumed by a patient of lactose intolerance include curd, yogurt, and ice cream. Curd, yogurt, and ice cream are well established substances obtained from milk which can be safely consumed by a patient of lactose intolerance. Okay, that was about lactose. Very quickly, I'll talk a little bit about maltose. Any questions so far? Anything you want to ask from the lactose part before I move on to maltose? Any questions you want to ask from the lactose part? Great. So we move on to maltose. So the same question, which are the building blocks? Which are the building blocks of maltose? Quickly, quickly, send in your answers. Send in your answers. Building blocks of maltose. Because it is a disaccharide, it must have two units. Which are the two units? Which are the two units in maltose? Very good, very good. 2 glucose, 2 glucose. The answer is glucose plus glucose. The linkage is alpha 1 4 glycosidic bond. Remember, it is a reducing sugar. It is a reducing sugar linked by alpha 1 4 glycosidic bond. It is found in malt whiskey known as malt sugar. It is obtained by degradation, or you can say fermentation of starch. It is obtained by fermentation of starch. The enzyme for breaking down maltose is maltase. Thank you very much. Okay, okay. So the enzyme maltase, just like lactase, it will be present on the intestinal surface, luminal surface it is present. So maltase is the enzyme which will break down the molecule maltose. Please note that there can be deficiency of maltase in individuals, but it doesn't present clinically. Reason being, the people get to realize is substances which they cannot tolerate when they are consuming maltose. It is typically present in, like I said, whiskey, etc. So they know which food to avoid. This is not applicable for lactose because it is the sugar in the milk, and when the child is born, initially he is provided the milk. So if there is intolerance, those patients quickly present to us in the pediatric emergency. So lactose intolerance is readily identified. Maltose intolerance is not identified. It is rare that a patient will come to you in the clinical setup with a maltose intolerance. Okay, last point I'll talk about the sucrose. Remember, maltose and the lactose were reducing sugar. Sucrose was a non-reducing sugar. So I'll ask the same question, which are the building blocks? Which are the building blocks for sucrose? Building blocks for sucrose. Very good, very good. We started getting the answer. I'll wait for some of you more to write in your answers. The building blocks for sucrose. Very good, very good. See, all of you know everything. We are just trying to summarize the information that you have and have a quick recap. All the information is there with you. We are just trying to bring it together so that you can revise it quickly. A concise revision text we are preparing. So it is made up of glucose and fructose. Now if you look at the bond, it will become clear why sucrose is non-reducing. The bond is alpha 1 2 glycosidic bond. Now in glucose, we have the aldehyde as functional group, which is present at carbon 1. Very good. Aldehyde present at carbon 1. In fructose, we have the keto group, which is present at carbon 2. So what is happening here? When the bond formation occurs, both the functional group are used up. So functional group is not free to react with the Benedict reagent. That's why sucrose will give us the negative reaction with Benedict reagent. Both functional group, the aldehyde and the keto group, are used up in bond formation. And that is why the reducing reaction does not occur. The enzyme for sucrose is sucrase, and just like the lactase and maltase, it is present on the luminal aspect of the intestinal epithelium. It is present on the luminal aspect of the intestinal epithelium. All right. One extra bonus point that I'll tell you very quickly about trehalose. Remember, we had written the trehalose in the list of non-reducing disaccharide. The trehalose is also made up of glucose plus glucose. What should be the linkage that you will find in a trehalose? Linkage that you find in trehalose, so that it should be non-reducing. Can you just quickly write the numbers? You have to tell me alpha dash dash glycosidic bond. Fill in the blanks. Fill in the blanks. In trehalose, what type of bond do you see? Alpha dash dash glycosidic bond. You have to fill in the two blanks. Blank number 1 and blank number 2. Very good. Very good, very good, very good. A lot of correct answers. Remember, in glucose, I had just told you the aldehyde functional group is present at carbon 1. So if you want to make a non-reducing disaccharide with two glucose moieties, you have to link both the functional group, and in both glucose it will be at carbon 1. So the answer is alpha 1 1 glycosidic bond seen in the trehalose, which is made up of two glucose. Alright, so this is about the disaccharides. I'll quickly go through the maltose, sucrose, and trehalose, and then we move on. Maltose, we had said it is made up of glucose and glucose, but the linkage is alpha 1 4 glycosidic bond. That is why it is still a reducing sugar. It is a malt sugar. Like we said, it is present in the whiskey. One of your friends had written that is also present in the Maltova and Milo. That is the correct answer. It is present in those substances also. The enzyme to break down on the maltose is the maltase. Again, just like lactase, it is present on the intestinal luminal epithelium. Then we have sucrose. Remember, sucrose is a non-reducing disaccharide. It is made up of glucose and fructose linked by alpha 1 2 glycosidic bond. The enzyme for digestion is the sucrase. Trehalose, the second non-reducing disaccharide, is made up of again of two glucose, and the linkage is alpha 1 1 glycosidic bond. So this is about the disaccharides that you must know. About the other oligosaccharides, I just mentioned very briefly. The other oligosaccharides typically act as fuel for gut bacteria because they are only partially digested. They are only partially digested in small intestine. Alright, we are talking about the other oligosaccharides. The reason for this is very straightforward. The reason for this is very straightforward. We don't have dedicated enzymes for the other oligosaccharides. We have generic enzymes which will split them in smaller molecules, or they'll cleave them from the end. But dedicated enzyme for the other oligosaccharides is not there. As a result, they are only partially digested. They only partially digested in the small intestine. Okay, So that would conclude our discussion about the oligosaccharide, and from here we move on to the polysaccharide. If you have any question, okay, about trehalose, we quickly take a look at the trehalose again. I said trehalose we had seen previously in the classification. It is a non-reducing sugar. It is a non-reducing sugar. Okay, and it is made up of 2 units of glucose, and it is linked by alpha 1 1 glycosidic bond. It is made up of alpha 1 1 glycosidic bond. Okay, so that was about trehalose. Extra anything about that beyond that you don't need to remember. Just remember it is made up of alpha 1 1 glycosidic bond. As a result, it is a non-reducing sugar. The two building blocks are the two glucose. The two building blocks are the two glucose. Any other question, any other doubts before we move on to the polysaccharides? Now we are moving on to the polysaccharides. Any questions so far? Any questions? Any other question besides the trehalose? Any other question besides trehalose? Okay. If you have no questions, just give me a thumbs up so we can move on to the polysaccharides. Great. No questions. No questions. Others, just give your feedback. If you have no doubts, we move on to polysaccharides. No questions. No questions. Great. Great. That's great to see. No questions. So we move on to the polysaccharides. The polysaccharides themselves are divided into two groups. One is the homopolysaccharides. Okay, hold the question for alpha. We'll talk about alpha and beta later on. I had told you when we do the isomerism, then I'll talk what is alpha, what is beta. Don't worry about alpha and beta at the moment. We'll talk about alpha and beta when we are doing the isomerism. All right, come back to the polysaccharides. We said we have the homopolysaccharide and the heteropolysaccharide. I'm sure the names are self-explanatory. Homopolysaccharide means same building block, means a particular monosaccharide is being repeated again and again. We have the same building block. Whereas in the heteropolysaccharide, we have the different building blocks. We have the different building blocks in the heteropolysaccharide. Okay, so we have the homopolysaccharide and we have the heteropolysaccharide. The homopolysaccharides are further clubbed as they're further clubbed as first glucan, also known as glucosan. What does this mean? Glucan or glucosan? In glucan or glucosan, all the building blocks are glucose only. So they are made up of only glucose. We have multiple molecules in this list. Most well known, starch and glycogen. In addition to this, you must remember that cellulose is also glucan or glucosan, and two other names. Details not required, but you should know the names dextrin and dextran. Very good. Are glucan or glucosan. Dextrin and dextran are glucan or glucosan. So homopolysaccharide made up of only glucose, starch, glycogen, cellulose, dextrin, dextran. Then Besides the glucan or glucosan, we have a similar category called fructan or fructosan. Obviously, the building block in this case will be will be fructose, and the molecule in this list is the molecule in this list is the inulin. Molecule in this list is the inulin. One special compound which is also home polysaccharide is chitin. Chitin has the building block of N-acetyl glucosamine. Although it is not a simple monosaccharide, still the same molecule is repeating again and again. So the chitin is also known as the homopolysaccharide. The chitin is also known as the homopolysaccharide. Now, most of the homopolysaccharide, when they enter the intestine, they can be degraded, but some of them cannot be degraded in the intestine. The cellulose and inulin, they cannot be digested when they enter the intestine, and therefore we call them dietary fibers. We call them the dietary fibers because although they are polysaccharides, they cannot be digested in the intestine. All right, so remember, cellulose and inulin are dietary fibers. They cannot be digested in the intestine. Here I would like to mention a few very important points about starch, glycogen and inulin before we move on to the heteropolysaccharides. Few points about starch, glycogen and inulin before we move on to the heteropolysaccharides, starting with starch. All of you know that starch is the storage form of carbohydrate in plants, right? It is a storage form of carbohydrate in plants. Now, one question which you should know, it is a conceptual question. Why the polysaccharide is the storage form? Why polysaccharide? Why not use the monosaccharide? See, when we convert the monosaccharide to polysaccharide, some energy is consumed. So making the polysaccharide is costly. So why not keep the monosaccharide itself? Why to make the polysaccharide for storage? This is one very fundamental question. So I'm quickly waiting for your answer. You can give the answer in 1 or 2 words. The reason why polysaccharide is used as storage form and why not the monosaccharide is used as the storage form. Okay, I'm waiting for answers. Waiting for answers. Non-reactive, insoluble, longevity. No, none of them are correct answers. Insoluble, not correct. Insoluble is not the correct answer. Monosaccharides are utilized for storage. No, that is not true. Monosaccharides are not utilized for storage. Monosaccharides are used up for energy, so we cannot keep them for storage. That is not exactly true. Whether they are getting metabolized or not depends on your energy requirement. Functional group, high energy, no, 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 no. Try again, try again. They are not correct answers. Try again. Okay, so I'll tell you the answer. I'll tell you the answer. See, there is something called, you must have heard this term in your 11th and 12th, what we call osmotic load? Shake is partly correct, but we'll quickly see. Osmotic load. What is the factor deciding the osmotic load? Osmotic load depends on number of particles. Now suppose you want to store, let's say, 10,000 glucose molecules inside the cell. So if you store 10,000 molecules, the osmotic load will correspond to 10,000 particles, which is very high. What will happen? The cell will burst. The cell will burst if you store 10,000 glucose moieties inside a cell. So what we do? We convert it into starch with 10,000 glucose, and this will be counted as one particle. This will be counted as one particle, meaning no osmotic load. So why do we use polysaccharides for storage? The answer is they have no osmotic load. Large amount can be stored without affecting the stability of the cell. The other points are not correct. The answer is the osmotic load is the criteria why we use the polysaccharides for storage. That was one. Second question, when we look at starch, we find the starch is made up of two types. We have the amylose and we have the amylopectin. Both of them are the forms of starch, the amylose and amylopectin. Amylose is linear, the amylopectin is branched. Amylose is linear, amylopectin is branched. Yeah. So which one is better? Which one is better? Camera is here. Everyone will see you. उधर ही दिखेगा. Okay. Uh, Let me finish this linear and branched, and then I'll go back to the osmotic load. Okay, let me finish this linear and branched, and then I'll go back to the osmotic load. Okay, so second question is, which storage form is better? Is it the linear form or is it the branch form? Which form is better? Which form? Which form is better? Which form is better? The linear or the branch form? Okay, branch form. So again, why the branch form is better? Why not the linear form? I'll preempt one of your answers. They occupy a similar space. They occupy similar space. But why are you saying that the branch form is better and why not the linear form? Thank you. Thank you. Take it down. Take it. Okay, anyone? Why are you saying the branch form is better and why not the linear form? I'm waiting for your answers. Just put in your answers why the branch form is better and why not the linear form. No answers this time? No one wants to give the answer? More stable. I'll keep writing the wrong answers here. More stable is not correct. Flexibility is not correct. Flexibility is not correct. Solubility is not correct. I'm sorry. Solubility is not correct. Anything else? Anything else? Anything else? These are all wrong answers. These are all wrong answers. Anything else? Okay, so I'll tell you. The answer is the branched form is easier to mobilize. Branched form is easier to mobilize. See, why are we storing the monosaccharide? So that we can use them when we need them. That is the purpose of the storage. You can use them when you need them. Now suppose you have the linear form. This is the linear form. All right, you have this linear form of the polysaccharide. When you want to mobilize this, you can mobilize one at a time. From the end, you are able to mobilize one at a time. This is what will happen for the linear form and the amylose form. But if you have the branch form, see what will happen in the branch form. The branches, multiple branches will be there. These can be still further branched. Now when you want to mobilize, you can mobilize from multiple places. So the branch form is easier to mobilize. That is why it is the preferred form of storage. And we'll see later in the animals, we only have the branch form. We don't have the linear form. We don't have the linear form. We only have the branch form in animals, which are the higher evolved state of life. So there we only see the branch form. So let's get back to the question. One of your friends had said that this osmotic load part was not clear. I'll quickly tell you. The osmotic load means the tendency of the substance to attract water. So it depends on the number of particles. More is the number of particles, more water it will attract. This is called the osmotic load. All right, now if you store 10,000 glucose molecules as monosaccharide, it will be counted as 10,000 particles, and therefore the osmotic load will be very high. 10,000 particles will exert a very large amount of osmotic load, and the cell will burst. So what is the way out? We convert the 10,000 particles into one particle. And how do you do that? We convert the 10,000 particles into the polysaccharide. The polysaccharide will be counted as one particle even though it has the 10,000 monosaccharides. Result, very negligible osmotic load. One particle will hardly exert any osmotic load. So no effect on cell stability if you are using the polysaccharides for storage. If you use monosaccharide, then the cell will not survive. Okay, so the starch, we are saying the amylose and amylopectin, two forms are there. The amylose is the linear form, the amylopectin is the branch form. The last point which I want to make here is the branching is very little. We call it poorly branched. How frequently? After 24 to 26 residues. The branching occurs after every 24 to 26 residues. The amylopectin is poorly branched. The branching we see after every 24 to 26 residues. All right. So this is the amylose and amylopectin, the two types of starch. Starch is the storage form of carbohydrate in the plants. All right. So that was starch. Let's quickly move on to glycogen. So the biggest benefit of doing the work from home or class from home is you don't have to worry about food. I'm sure all of you must be being well fed by your parents while you are doing the class. The same is true for me also. So it keeps coming after some time. Something will come, okay, eat this now and eat that. So please enjoy this time. You shouldn't starve yourself while you're doing the class. Make yourself comfortable. You are at your home only, so keep demanding some good food. Tell them that I'm working hard, give me some good food. Okay, so that you can make more and more glycogen, and your brain keeps working. But don't eat so much that you feel sleepy. All right. Okay, let's go on to glycogen. Glycogen is the storage form in the animals. Storage form in animals, so we call it the animal starch. Yes, that's true. All of us are putting on weights. Okay, so once the social distancing is closed down, there will be social distancing between the buttons of our shirt. Let's come back to our glycogen. What happened? What happened? Is the buffering occurring at your end also, or is it only on my screen? Everyone is able to see. Is everyone seeing this buffering, or everyone has the full screen? No connection. Okay. Okay. So we come back. Okay, we come back to glycogen. Glycogen is the animal starch. Now it is highly branched. Okay, so must have been a problem at my end. It is highly branched, and when we say highly branched, what does it mean? Okay, branching after 10 to 18 residues on an average after every 12 residues. So the glycogen is highly branched, amylopectin is poorly branched, and glycogen is highly branched. All right. Now, one very important point to note: only in few tissues you find the glycogen, only in a few tissues in significant amount. It can be synthesized in all tissues in very small amount, but storage occurs only in a few tissues. And what are those tissues? Liver, most important. Liver, most important. Muscle, again equally important. Liver and muscle. And you must remember, significant amount also synthesized in the brain. The muscle and liver are similar in terms that glycogen is only for local use. Glycogen is only for local use, means the muscle will use the glycogen for itself, the brain will use the glycogen only for itself, whereas the liver, glycogen has a different function. It maintains blood glucose. The function of liver glycogen, it maintains the blood glucose. All right. So glycogen is the storage form in the animals. It is therefore known as animal starch. It is highly branched, as you can see. It is highly branched. Branching occurs after every 10 to 18 residues. On an average, you will see branching after every 12 residues. Significant amount, meaning storage. I'll write this term: storage occurs only in a few tissues: liver, muscle. These are the two well known. In addition, remember that brain is also a site where the storage of glycogen can occur. I'll repeat here: Small amount of glycogen is synthesized in all the tissues. All right, we'll see later on when we are doing the glycogen metabolism and the associated disorders. There I'll highlight again small amount of glycogen synthesized in all the tissues. Okay, the last name that we want to discuss here, which I told you you should know about, is the inulin. Remember, inulin was the fructan. Building block is fructose. Building block is fructose. Few questions. From where do you get? From where do you get the inulin? What is the source of inulin? Source of inulin. Source of inulin. Okay, so mostly it is the tubers, and that too from the dahlia family, the sunflower, safflower, dahlia flowers. In the tubers, you will find the inulin. Remember, we had mentioned that inulin is a dietary fiber. Not in wheat. Inulin is not there in wheat. Please note, inulin is not there in wheat. What do you mean by dietary fiber? When we say dietary fiber, it means it is not digested. When I say dietary fiber, means it is not digested. What is the importance of inulin? Anyone can tell me? Why I'm telling you about inulin? There is an overlap with the physiology aspect. You should know what is the importance of inulin. Why I'm mentioning the inulin again and again. Importance of inulin. Uh, Anything else? Anything else? Very good. Very good. It is used to determine, or you can say measure, clearance. It is used to measure clearance. In other words, the glomerular filtration rate. It is used to measure clearance. In other words, glomerular filtration rate. Here you should remember which properties, which properties of inulin enable its use for measuring clearance. So I'll quickly highlight. It is not digested. Similarly, inside the body, it is not metabolized. So it will not be metabolized. It is it is not reabsorbed in tubules. It is not secreted in tubules. See, the third and fourth, everyone remembers it is neither absorbed not secreted in the tubules, but you forget that it is also not metabolized. Please remember, besides absorption and secretion, metabolism is also an important factor whether you can use a substance for determining GFR or not. Because what we are measuring is the change in concentration. And if there is change in concentration due to metabolism also, then your GFR estimation will be overestimated. Okay, so you have to ensure that the substance should not metabolized, it is not reabsorbed in tubules, it is not secreted in the tubules. Only then you can use it for measuring the clearance or the GFR. The last question is, how do you administer the inulin when you are giving it to the individual for measuring the clearance? How do you administer the insulin? Is it given oral? Is it given subcutaneous? Is it given intramuscular? Is it given IV? What is the route? What is the route? How do you administer the inulin? I'll repeat something which I had said at the beginning of the class when we are doing the classification. At that point I had said one statement, if you recall: only monosaccharides are absorbed from the intestine. This is what I had said. Only monosaccharides are absorbed from the intestine. And second point which I made here, inulin is not digested. So how will inulin reach inside the body if you give it orally? It cannot cross the endothelium in the GI system, in the intestine. It will not get absorbed. So it has to be administered IV. Please note, intravascular administration has to be given. This means it is an invasive procedure. It is an invasive procedure, and therefore it is used only for research, not for patients, because in patients we already have certain analytes which can be used for measuring the GFR. So you have to tell me which analyte is used for measuring GFR in patients. How to determine GFR in patients? Which analyte is used? Because in patients we don't use the inulin for measuring the GFR. I'm waiting for your answers. Great. So, like your friends have said, we have two analytes, urea and creatinine. We have two analytes, urea and creatinine. Out of the two, remember, creatinine is the preferred analyte. Preferred analyte is the creatinine. Creatinine clearance is the preferred analyte. Reason being, urea is easily affected by multiple factors, whereas creatinine clearance is steady. So creatinine clearance is the preferred modality for measuring the GFR in the patients, because creatinine is being produced by the body. We don't need to give it from outside. So it is the preferred analyte for determining in patients. However, it is not as precise as the inulin. Okay. So this is about the inulin that I wanted you to know. You must remember about inulin. Very frequently we get the question talking about the GFR, role of inulin, and these points that I have mentioned. I'll quickly go through them once again. Let's talk about inulin. Okay. So inulin, we had said it is a fructan. It is obtained from the tubers of the Dahlia family. So mostly you'll find it in tubers. We had said that it is a dietary fiber, meaning it cannot be digested. Dietary fiber, meaning it cannot be digested, and its importance is to measure the clearance. In physiology, it is used to measure the clearance in research because it gives a very precise value for the glomerular filtration rate. The properties which make it suitable for measuring the clearance is it is not digested, it is not metabolized, it is neither reabsorbed in the tubules, and it is neither secreted in the tubules. Because of these properties, it is the ideal candidate for measuring clearance. Because it cannot be absorbed from the intestine, it has to be administered IV. This is a drawback because since it is an invasive procedure, we don't use it routinely, and because we have better analytes which are present already in the body. So insulin clearance is used only for research, not for patients. In patients to determine the GFR, we prefer to use the creatinine clearance, else we'll use the urea clearance. Now I see one question which has been put up talking about the serum creatinine or urine creatinine. So if you recall, we had done this practical in your first year. For determining the clearance, you need three parameters. You need three parameters to determine the clearance. What are they? You need the serum concentration. You need the urinary concentration also. And lastly, you need the urinary flow rate. So until unless you know these three things, urinary flow rate is typically in the milliliter per minute. If you don't know this, you are not able to determine the clearance. So you must have these three values provided to you: the serum concentration of the analyte, the urinary concentration of the analyte, and the urinary flow rate. Only then you can determine the clearance. All right, these three values are required to determine the clearance. I hope this makes it clear to everyone how to calculate what parameters are required for clearance. I'll not go into the details of calculation. They are not required for PG exam. There is no point in wasting our time. But just remember the parameters required for calculation of clearance. It is the serum concentration, the urinary concentration, and the urinary flow rate. Using these, we have the formula. You put in the values, and you can quickly calculate the clearance. Whether you're using the creatinine, or you're using the urea, or you're using the inulin. Okay, so that was about the homopolysaccharides. From here, we are going to move on to the heteropolysaccharides. Any questions so far? We started discussing polysaccharides, we talked about the homopolysaccharides, and now we are moving on to the heteropolysaccharides. If you have any questions, I'll wait for 10 seconds. Just quickly punch in your questions if you have any queries, any part you want me to repeat. Okay, I can see two questions. Three questions. Okay, okay. I'll take them one by one. First is PA. Can anyone tell me? We have a question. Akshay has asked, what about pH? Anyone who can tell me what is pH used for? How is it different from inulin? Anyone who wants to answer, what is pH used for? Very good. Very good. See, when we talk about kidney, we have two parameters. One parameter that we've already seen, it is the glomerular filtration rate. It basically tells us how much ultrafiltrate is being formed. It tells us how much ultrafiltrate is being formed. The second point that we can measure is renal plasma or the blood flow. Now, to determine the renal plasma or blood flow, we need an analyte which is completely excreted in a single pass. Analyte which is completely excreted in a single pass, that is required for determining the renal plasma or the blood flow. Reason being, reason being, reason being, the ultrafiltrate doesn't cause complete excretion. Ultrafiltration doesn't cause complete excretion. So we require two things: filtered but not reabsorbed, and unfiltered is secreted. All right. So we need an analyte which has these two properties. It should be readily filtered, but it should not be reabsorbed. In addition to this, whatever amount is unfiltered, that amount should be secreted. Once these 2 points are achieved, we'll find that complete excretion has occurred in a single pass, and that is what we find with pH. pH is an analyte which is filtered, it is not reabsorbed, and whatever amount is unfiltered in the blood is completely secreted. So, like I said, complete excretion, complete excretion, complete excretion, complete excretion in a single pass. Completely excreted in a single pass. To determine the renal plasma blood flow, an analyte should be completely excreted in a single pass. For this, it must have two properties. It should be filtered, but it should not be reabsorbed. That's point number one. And whatever amount remains unfiltered must be secreted. If these two conditions are fulfilled, then we can use the analyte for measuring the renal plasma blood flow, plasma or the blood flow. And PAH has these two properties, therefore we use PAH, that is the para amino hippuric acid, for determining the renal plasma flow. I hope that clears it up. Akshita, is it clear? If it is not clear, tell me. I'll try to explain it in a different way. Akshita, I hope it is clear now. Okay, great. Okay, great. So that was first question that we had taken. Let me see what other questions are there. Okay, what about pH? Starch cannot be absorbed in our body. Okay, so another question was starch not absorbed but digested in intestine. Digested means, what do you mean by digested? Broken down into monosaccharides. Okay, so starch, cellulose. Uh, all right. Why do you wash out starch, rice? This question is not clear. I have a question here. Wash out starch from rice. Can you repeat this question? Because you're advised not to drain water while cooking rice. You should take only just the sufficient amount of water so that you don't need to drain it when you are cooking, because it will carry out a lot of starch and vitamins and minerals. So can you clarify this question? What do you mean by wash out starch from rice? It is not advised. It is not advised. Okay. Any other question? Any other question which I missed? Because I just scrolled up and I have tried to take up all the questions which were there. Any other question which you want me to take up before we move on to the heteropolysaccharides? Any other question? Okay, so let's move on to the heteropolysaccharides. We've talked about the homopolysaccharides, and now we are moving on to the heteropolysaccharides. All right, we have large number of different heteropolysaccharides. For example, you have lignin, we have pectin, we have hemicellulose, gum. Gum is also a heteropolysaccharide. And last in this list, which is the most frequently and most commonly asked, is the glycosaminoglycans, commonly known as the GAG, commonly known as the GAG. The other name for this molecule is mucopolysaccharide because it was first extracted from the mucus. So the polysaccharide present in the mucus is the mucopolysaccharide. All right. One extra point that I like to make here: all these, all these are dietary fibers. All these are dietary fibers. meaning they will not be digested. They will not be digested. If you consume them, they will not be digested. Please note, gum is not generally present in diet. So if you to choose from these which is not a dietary fiber, your answer should be gum. Gum is commonly not present in the diet. So if at all it is present, it will not be digested, and then we can label it as a dietary fiber. But practically speaking, very rare instances where you'll find the gum in your diet. Okay, so let's talk a little bit about the glycosaminoglycans. Mhm. मैं आगे बताता हूँ क्लास के बाद, ठीक है? Mhm. So this is the drawback of working from home. uh, you cannot avoid these little miscreants coming into the camera and taking your pen. Chalo, chao, go. Okay. uh, Glycosaminoglycan, all of them, we will not label them as the fibers. Some amount of breakdown does occur, but that's why I've not included the whole group into the dietary fibers. Some degradation does occur, but not complete, not complete. So it is not, we cannot put the whole category in the dietary fibers. Thank you very much. Thank you very much. Okay, so let's talk a little bit more about the glycosaminoglycans. The building blocks. What are the building blocks of the glycosaminoglycans? We have two things. First, the amino sugars. First, the amino sugars means the monosaccharides to which amino group has been attached. So basically, the monosaccharide to which the amino group has been attached. And second, uronic acid. Uronic acid. Please note, uronic acid is most commonly present in the glycosaminoglycan. Obviously, there can be certain exceptions where the uronic acid may not be there, but most of them will have this standard composition. The amino sugar and uronic acid repeating n a number of times. So strictly speaking, they are repeating disaccharides. To put it in very simple words, they are repeating disaccharides. Amino sugar and ionic acid. This structure is getting repeated again and again. In addition, multiple groups, sulfate, phosphate, acetyl groups are also attached. Multiple sulfate, phosphate, and acetyl groups are attached either to the building blocks or after the product has been formed. Result is result is very high negative charge. The result is very high negative charge. Because of this very high negative charge, the glycosaminoglycan are successfully able to perform two very important functions. They can function as lubricants and they have gel like nature. In other words, they are able to counter or withstand great pressure. Okay, so these are the two very important functions of the glycosaminoglycan, which is made possible due to the very high negative charge, the action as lubricants, and the gel-like nature. See what happens when we talk about the lubricant function. Imagine these are two molecules, two magnets. This is the north pole. This is also the north pole, and you try to bring them together. I'm sure all of you must have done this in your physics class whenever there is free time. Today I'm going to bring the two North Pole together. Nobody can stop me. So what we do? What we do? We bring them together. We bring them together. See, it is about to stick. It is about to stick. We bring them together, and at the last moment, it will slip. It will slip at the last moment. So that is the same thing which is happening here. The negatively charged particles, they come close together when there is pressure, and when they come too close, the negative charge, they will not allow them to attach, rather they will slip around each other. So this is the lubricant function. And gel like nature is, the negative charge allows to absorb a lot of water. All right, so it helps to fill up space. It helps to fill up space when there is no pressure. When there is pressure, this pressure will displace the water, so underlying structure will remain the same. When there is empty space, it can be filled with water. When there is pressure, that water will go out, the underlying structure will remain the same. This is the second function performed by the glycose aminoglycans. The third part which you have to know here, which are the glycose aminoglycans that you should know about. So the hyaluronic acid, the chondroitin sulfate, dermatan sulfate, the keratin sulfate, heparin, and the heparin sulfate. All right. So these are some of the common glycosaminoglycans that you should know about. Now I'm going to show you a very brief table. The actual table has a lot of information, but I'm showing you a brief table where I want to highlight a few points and certain important tissues where some of these glycosaminoglycans are distributed. Okay, so so that part of the table which I'm going to show you is very important. So please make note of the table that I'm going to show you now. Okay. Mm, okay. So in this table, what you have to make note of, the keratin sulfate being of two types, keratin sulfate type 1 and 2. It is the only glycosaminoglycan which does not have uronic acid. It is the only glycosaminoglycan which does not have the uronic acid. Now, a little bit about distribution. Obviously, if you see in the textbooks, distribution for all the glycosaminoglycan is given. Large number of options are there, but they are not important. What is important, I am showing you on the screen. First, for hyaluronic acid, very widely distributed in the synovial fluid, in the vitreous humor. These are the two places where they find large amount of hyaluronic acid. Then the chondroitin sulfate, cartilage, bone, cornea. It is said to be the most widely distributed glycosaminoglycan. The chondroitin sulfate is said to be most widely distributed. Let's see if we can enlarge it. Okay, what I'll do is copy. It doesn't allow me to paste. Let me see if I can paste it. It doesn't allow me to paste. Just hold on, give me 1 second. Let's see if we can bring it to you. Okay. It doesn't paste. Whew. Okay. I hope it is visible now. I enlarge it further. Is it visible now? Is it visible now? Is it visible now? Okay. So, like I said, the keratin sulfate. Okay, keratin sulfate doesn't contain the uronic acid. You can see no uronic acid is present in the keratin sulfate. Keratin sulfate will have no uronic acid. All right. Uh, let's see. I'll try to. Okay. Now the hyaluronic acid is present in synovial fluid and in the vitreous humor. Hyaluronic acid present in the synovial fluid and vitreous humor. All right. The chondroitin sulfate is present in cartilage, bone, cornea. I told you it is the most widespread, most widely distributed glycosaminoglycan. Then the keratin sulfate type 1. The keratin sulfate type 1 is also found in cornea. In addition to the chondroitin sulfate, the keratin sulfate type 1 is also found in the cornea, and heparin is found in the mast cells. Heparin is found in the mast cells. Okay, this was some distribution that I wanted to tell you. Now, the second part of this scenario is the okay. Okay, so the glycosaminoglycan we said are very widely distributed in the body. They are widely distributed in the body. We had seen various places where they are present, and we had seen the important functions. They have a gel-like function, and they act as lubricant. For example, so you want to have some movement at the joints, so you'll need lubrication, which is provided by the synovial fluid. So synovial fluid will contain the glycosaminoglycan. The movement of the eyeball. So in the vitreous humor, again, vitreous humor is the liquid where the movement is occurring. So we require the glycosaminoglycan to provide that. A lot of pressure is exerted on the cornea, on the retina, on the bones, and on the cartilage. So they will also require the glycosaminoglycan. Now, these glycosaminoglycan, when they are deposited in the extracellular matrix, they undergo recycling. Recycling means they are degraded again synthesized, again degraded, again synthesized. So continuous recycling of the molecules occur. Sometimes the recycling becomes defective, and this defect is particularly related to the degradation. So if the degradation is defective, what will happen? What will happen? If there is defective degradation, we will find accumulation. The gags will start accumulating. If the recycling is defective, particularly at the degradation level, there will be accumulation of glycosaminoglycans, and this accumulation of glycosaminoglycans is commonly known as MPS, also known as mucopolysaccharidosis. So accumulation of glycosaminoglycan due to defect in the breakdown is known as the mucopolysaccharidosis. All right. Previously, the mucopolysaccharidosis used to have names, but nowadays we have numbers. So I'll briefly mention the names and the corresponding numbers so that you can correlate them. Remember, in case of mucopolysaccharidosis, there are some very important common features in the patients. Some very important features in the patients. We find mental retardation. We find corneal scarring. We find skeletal deformities. These are some of the very important outstanding features in the patients of mucopolysaccharidosis, and mostly the inheritance pattern is autosomal recessive. Obviously, there are certain exceptions, we'll cover them, but remember, mental retardation is seen, corneal scarring is found, the skeletal deformity is there, and autosomal recessive inheritance will be there. First, I'll list the disorders, then anything specific which is there, I'll highlight that. So nowadays we have the numbers. So we have MPS type 1, we have the MPS type 2, MPS type 3, MPS type 4, MPS type 5 does not exist, MPS type 6. There are others beside this, but you need not know about them. Even the details of these you need not know, but sometimes they'll land up in your exam, so we'll cover them. The classical MPS 1 was the Hurler disease. The classical MPS 1 was Hurler disease. In the beginning, when we were doing the classification 1, 2, 3, 4, 5, at type 5, we had classified the disease called Shees. But when biochemical investigations advanced and we were able to do the enzymatic analysis, we discovered that the defect in Hurler's and Shees is the same. So MPS 5, which was the Shees disease, was moved to a subtype. It was moved to the subtype 11 of type 1, and the Shees has been labeled here. The Hurler's is a quite severe disease, whereas the Shees is quite mild, so mild that we don't find mental retardation here. In addition, we have an intermediate form which is called HS disease. We have an intermediate form which is called the HS disease. So MPS 1 is of three types: 1H, 1HS, and 1S. The three subtypes of MPS 1: 1H, 1HS, and 1S. 1H is the classical hurlers, and 1S is the classical Shee's disease. Previously, it was classified under type 5, but now we don't have type 5. It has been shifted to MPS type 1. MPS type 2, classical name was the Hunter's disease. Classical name was the Hunter's disease. So hurler, hunter. Type 3 is the classical San Filippo's disease, and we have the Marquez disease. 3 and 4 not very commonly asked, but remember San Filippo's is one of the most commonly encountered mucopolysaccharidosis. Type 6 is known as the Maroteau Lamy disease. It is known as the Maroteau Lamy disease, and type 7, classically known as the Sly disease. So these are the classical names for the mucopolysaccharidosis. If you have to remember the MPS type 1, MPS type 2, and the MPS type 6. Okay. Now the hunters is slightly different from the others, reason being all of them we had said was the autosomal recessive, but this one is X-linked. In addition, we don't find corneal scarring. We don't find the corneal scarring. Hunter's disease, X-linked, and no corneal scarring is seen. Now you will see that I have highlighted three: the MPS 1, that is the hurlers; MPS 2, that is the hunters; and MPS 6, that is the Maroteau Lamy disease. The reason being, for these three conditions, we have enzyme replacement therapy. Successfully, enzyme replacement therapy has been utilized for these three conditions, and therefore you must remember the defective enzyme in each of them. You must remember the defective enzyme in each of them. I'll list them here. In one, we have iduronidase. Defective enzyme is iduronidase. In two, we have the iduronate sulfatase. In two, we have the defective enzyme as iduronate sulfatase. And in six, not three, but in six, the defective enzyme is aryl sulfatase B. These are the three names which you have to remember. The three names which you have to remember: the iduronidase, the iduronate sulfatase, and the aryl sulfatase B. Okay. So What you have to remember in the MPS, the numbering and the corresponding old names, the difference that we see in the hunters, the X-linked and the no corneal scarring. And the point that the Shees disease is now part of type 1, it is the mild form, it doesn't show the mental retardation. And the three disorders for which enzyme replacement therapy is available, and they are the MPS type 1, the MPS type 2, and the MPS type 6. The corresponding enzymes which are defective are the iduronate, iduronate sulfatase, and the aryl sulfatase B. Nowadays, the diagnosis is based on enzymatic assay and genetic analysis. Nowadays, the diagnosis is based on enzymatic assay and genetic analysis. So the previous question which was there about the metabolites, which metabolite is there, which particular analyte is elevated in which particular disorder is no longer asked. We focus on enzymatic assay and the genetic analysis for diagnosis. Okay. In MPS, we had said that the defect is there in degradation. The defect is there in degradation, meaning one or more enzymes are missing. One or more enzymes involved in the degradation are missing, and we've just listed the different enzymes for MPS 1, 2, 6 which are missing. If these enzymes are missing, the degradation will not occur properly. So what you can do, you replace, in other words, you supplement from outside. If you supplement from outside, these enzymes will go to places where the accumulation has occurred, and when these enzymes will become available, they will be able to break down the mucopolysaccharide, and this accumulation will disappear. When you replace the enzyme from outside, we call it the enzyme replacement therapy. When you replace the enzyme from outside, we call it the enzyme replacement therapy. The glycosaminoglycan are very commonly present in the extracellular matrix. Sometimes they are present in the free form, but very commonly the glycosaminoglycans will combine with proteins, and they form what are known as the proteoglycans. Proteoglycans are very important for transmission of information from cell to cell. They are very common products present in the extracellular matrix, and they are critical for the neural development. That is why when the glycosaminoglycans are not there, we find the mental retardation. Only the mildest form, the She's, has no mental retardation. All other forms of glycosaminoglycan defect or accumulation will result in the mental retardation. Remember, glycosaminoglycan plus protein will together form the proteoglycans. Depending on the cluster, the proteoglycans can be monomers, or if we have bigger clusters, we call them the proteoglycan aggregan. We call them the proteoglycan aggregan. So defective proteoglycan formation is the cause for mental retardation. Defective proteoglycan formation is the cause for mental retardation. So this part cleared, everyone. The mucopolysaccharide section, particularly the glycose aminoglycan. I'll do a quick recap, and then I'll take any questions if you have from the glycose aminoglycan. Okay, we talked about the heteropolysaccharide. We said they will not have the same building block, they will have the different building blocks. Some examples are lignin, pectin, the hemicellulose gum and the glycosaminoglycans. The lignin, pectin, hemicellulose, and gum are definitely dietary fibers. Glycosaminoglycan are not strictly classified as dietary fibers because partial degradation does occur. Glycosaminoglycan are also known as the mucopolysaccharides, and they are made up of two substances. They contain the amino sugars, the monosaccharide where amine group has been attached, and they include uronic acid. What is uronic acid? Anyone? They are oxidized monosaccharide. Oxidized monosaccharides. Okay, so amino sugar and uronic acid will combine to form the mucopolysaccharides. In addition to these two, we also find large number of sulfate, phosphate, and acetyl groups attached to the molecules. As a result, the mucopolysaccharides have very high negative charge. They have a very high negative charge which allows them to function as lubricants. They are very good lubricants, particularly in the soluble fluid, and they have a gel like nature because of which they are able to withstand great pressure. They are able to withstand great pressure. Some of the important and the common glycosaminoglycans are the hyaluronic acid, the chondroitin sulfate, dermatan sulfate, keratin sulfate type 1 and 2, heparin and heparin sulfate. Heparin and heparin sulfate, all of them are the glycosaminoglycan. We had seen in the keratin sulfate, we don't have the uronic acid, and we'd also briefly seen the distribution of the different important glycosaminoglycans. Now, I said at this point that the glycosaminoglycans are continuously recycled in the body. They are synthesized, they are deposited, they are broken down, again synthesized, again broken down. Sometimes this breakdown part, that is the degradation part, is defective. Degradation part is defective. Okay, so they're getting deposited in the extracellular matrix where the enzymes will be secreted for breaking down these glycosaminoglycan. Fresh glycosaminoglycan will be secreted from the cells, and in this way the recycling keeps occurring. Sometimes when the enzymes are missing, these glycosaminoglycan will start accumulating because synthesis is occurring, but degradation is not occurring. Because the degradation is not occurring, the accumulation will occur. This accumulation of glycosaminoglycans is known as the mucopolysaccharidosis. The mucopolysaccharidosis have old traditional names, but now we have given them numbers. All right. Some of the common features for all the mucopolysaccharidosis is they will present with mental retardation. They will present with corneal scarring. They will present with skeletal deformities, and they will present with autosomal recessive inheritance pattern. These are some of the outstanding features of the mucopolysaccharidosis. Now, MPS type 1 is now having three subtypes: 1H, 1HS, and 1S. So, if you write them, you'll write them as 1H, 1HS, and 1S. Okay, this is how we write them: 1H, 1HS, and 1S. 1H is the Hurler's, 1HS is the intermediate disease, and 1S was the old initial classic Shees disease. The H type is the most severe, and S type is the mildest out of the three. All right, and Shees disease is also the mildest of the different MPS, so that it doesn't show mental retardation. It is the only MPS not showing the mental retardation. We have an intermediate form which was the 1HS form. MPS 2, the classical Hunter's disease, is X-linked. In addition, it doesn't present with a corneal scarring. In addition, it doesn't present with corneal scarring. MPS 3 is the San Filippo, and MPS 4 is the Marcuse. MPS 5 no longer exists. Initially, the Shees was labeled as MPS 5, but now we know that it is a subtype of type 1. MPS 6 is the Maroteau-Lamé disease, and MPS 7 is the Sly disease. Out of these, the enzyme replacement therapy, where we replace the deficient or the defective enzyme with the normally acting enzyme, is available for three conditions: the MPS 1, MPS 2, and MPS 6. The corresponding enzymes for MPS 1 is iduronidase, for MPS 2 is iduronate sulfatase, and MPS 6 is the aryl sulfatase B. Remember, the diagnosis is based on the diagnosis is based on enzymatic assay and genetic analysis. If you have to choose one out of the two, then we will go for genetic analysis. The final confirmation is on the basis of genetic analysis. Enzymatic assay can be the precursor, the stage at which you can start the management if you are talking about the enzyme replacement therapy, but confirmation definitely is by genetic analysis only. Last point I told you, the glycosaminoglycan can combine with proteins to form the proteoglycans. They are very important molecules for cell-cell interaction and for the neural development. They are very important components in the extracellular matrix in the CNS. So in case the proteoglycans are not well formed, it will result in the mental retardation. So these are some of the points we talked about in the heteropolysaccharides. Any questions which you want me to answer at this stage? Else, I'll move on to the isomerism that we see in the carbohydrates. We've completed the classification and now we move on to the isomerization. Any questions so far? Any questions you want me to take from the classification of the carbohydrates that we have done? It can be from the initial classification or for the polysaccharides. Anything you want to ask. Any questions at this stage before we move on to isomerism? Okay, so we have one question. Where do the glycosaminoglycan accumulate in MPS? So the accumulation, mostly it occurs in the extracellular matrix. Mostly it will occur in the extracellular matrix because that is where the glycosaminoglycan are secreted, and the degradation has to occur in the extracellular matrix only. So accumulation occurs in the extracellular matrix. Any other question? Any other question? Okay, so we'll move on to the isomerism part. We'll move on to the isomerism part. Let's take up the isomerism seen in the carbohydrates. Let's talk about the isomerism which is seen in the carbohydrates. Now, the isomerism in the carbohydrates can be of three types. The isomerism in carbohydrates can be of three types. First is the stereoisomerism. Second is the ring isomerism. and third is the functional isomerism. The functional isomerism we've already seen. The functional isomerism we've already seen. I'll quickly complete of the functional isomerism. We had said the two subtypes of functional isomerism, the aldose form and the ketose form, depending on the functional group, whether it is the aldehyde group or the keto group. For example, glucose fructose, same formula, but the aldose in glucose and the ketose in fructose. Okay, so three subtypes: the stereoisomerism, the ring isomerism, and the functional isomerism. Now, for stereoisomerism, we have a very important requirement. For stereoisomerism, you must have what is known as the chiral carbon. Anyone can tell me what do you mean by a chiral carbon? Anyone can tell me what do you mean by a chiral carbon? What is a chiral carbon? Akshay, Sandhuri, what is a chiral carbon? Akshita, Sheikh, I'm waiting for your answers. What is a chiral carbon? Anyone? Okay. So chiral carbon, very strictly speaking, is carbon where all four valencies are occupied by four different groups. Where all four valencies are occupied by four different groups. That is what we call the chiral carbon. So chiral carbon is the basic minimum requirement to see the stereoisomerism. So once you have the chiral carbon, we'll see the stereoisomerism. What are the different types of stereoisomerism? Let me list. First, we see what is known as enantiomerism. Most frequently, you'll get the question from this enantiomerism, and the enantiomerism can be of two types. The enantiomers are either the D form or the L form. Enantiomers are the D form or the L form. In terms of stereoisomerism, if the molecules are not enantiomers, then they will show diastereomerism. A very special subtype of diastereomerism is epimerism. We'll take them up one by one, don't worry. A very special subtype of diastereomerism is the epimerism. And lastly, we have what is known as the anomerism. A very special point about anomerism is it is seen only in ring structure. Anomerism is seen only in a ring structure. Okay, so these are the three different subtypes of the enantiomerism, sorry, of the stereoisomerism. That is the enantiomerism, the diastereomerism, and the anomerism. Okay, the three. Okay, so in between I was not getting the chats. Now I've started getting the chats. Great. Repeat diagnosis. Okay, functional protest, active carbon, chiral carbon, bonding carbon, asymmetric carbon, ready to pair, asymmetric carbon. Okay, okay, okay. So great. So the stereoisomerism, enantiomerism, diastereomerism, anomerism. We'll take them up one by one. The ring isomerism. two subtypes, the furanose form and the pyranose form. The two subtypes, the furanose form and the pyranose form. For the functional isomerism, we already seen we have the aldose and the ketose form. We already seen we have the aldose and the ketose forms. So these are the subtypes of isomerism that you will come across. We'll take them up one by one. We'll take them up one by one. Let's start with enantiomerism. By definition, when I say enantiomerism, we are talking about non superimposable, non superimposable mirror images, meaning the two molecules which will be called the enantiomers, they are mirror images, but the two mirror images cannot be superimposed over one another, so they are non superimposable mirror images. I'll take an example and it will become very clear. I am drawing a hexose sugar, that's glucose. Okay, this is carbon 1, this is carbon 2, this is carbon 3, this is carbon 4, this is carbon 5, this is carbon 6. All right, this is glucose. All right, now in this structure you have to tell me which all carbons, 1 2 3 4 5 6, out of them which all carbons are chiral carbon. Quickly write down, out of the 6, which all carbon are the chiral carbon. I'm waiting for the answer. Okay, okay. Others. Okay, okay. Sudarshan, Sai Srinath, Akshay, Uzma. Great. So your answer is carbon 2, carbon 3, carbon 4, and carbon 5. See, if you look at carbon 6, if you look at carbon 6, two valency is occupied by hydrogen, so it is not chiral. It is not asymmetrical, it is symmetrical carbon. If you look at carbon 1, two valency is occupied by O, so it is not chiral. It is not chiral, it is not asymmetrical. So the answer is 2, 3, 4, and 5 are the chiral carbons. So now we will draw the mirror image. In the mirror image, what will happen? The arrangement will be opposite on the chiral carbons. Only the chiral carbon will show opposite arrangement. So structure will be something like this: P double bond O. Here the hydroxyl group will be on the opposite side. Here again the hydroxyl group will be on the opposite side. Here again, the hydroxyl group will be on the opposite side. The hydroxyl group on the opposite side. So what happens on all the chiral carbon? The arrangement of the groups is opposite. It is still a glucose molecule. It is still a glucose molecule, but the arrangement of the hydroxyl group on all the chiral carbon is opposite. That is 2, 3, 4, and 5. Please note that is the linear structure. We are drawing the linear structure. Now these two images that you can see on the screen are enantiomers. They are non-superimposable mirror images. I told you the enantiomers can be of two types, the D type and the L type. So what I'll do, I'll label them as number 1 and number 2. You have to tell me which is the D form and which is the L form. Out of 1 and 2, which is the D form and which is the L form? Anyone? The D form and the L form. I'm waiting for answers. One is D. Cycron says one is D. One is D, two is L. Sudarshan says one is D, two is L. Anyone else? One is D form. Okay, two is D form, two is L form. One is D, two is L. One is D, two is L. Very good. So how do we determine which is the D form, which is the L form? Very simple. What we do, we look at we look at the last chiral carbon. We look at the last chiral carbon and check the orientation of the hydroxyl group. Look at last chiral carbon and check the orientation of hydroxyl group. If it is on the right side, the D form. If it is on the left side, the L form. So D form and L form depend on the orientation of hydroxyl group on the last chiral carbon. Please note the term. I have said the last chiral carbon. The last chiral carbon happens to be the second last carbon. It happens to be the second last carbon, also known as the penultimate carbon. So you look at the orientation of hydroxyl group on the last chiral carbon or the penultimate carbon, and based on that, we use the terms D and L form. For complex molecules where this distinction is not very clear cut, the reference molecule for enantiomerism, the reference molecule is glyceraldehyde. Please note the simplest triose is used for reference to determine whether it is the D form or it is the L form, because there we don't have the confusion of which carbon to look at. There is only one chiral carbon, and based on that we describe the D form and the L form. So this is the enantiomerism. It is clear to everyone. Now I'll make some small changes. Okay. Now I've made a very small change, as a result of which number 2 is no longer the mirror image of number 1. Number 2 is no longer the mirror image of number one. Previously it was a mirror image of number one, but now it is not the mirror image of number one, because these are now similar, meaning this is not enantiomer. They are different molecules, but they are not enantiomer, because at one place there is similarity, at other places there is difference. So this is what we call diastereomer. In diastereomerism, what we find? We find difference at 1, 2, or 3 chiral carbon. Difference is there at 1, 2, or 3 chiral carbon. At least one chiral carbon must have similar arrangement. At least one chiral carbon must have similar arrangement. In that case, we have the diastereomerism. At least one chiral carbon must have similar arrangement, and then we get the diastereomerism. I told you there is a special subtype, epimerism. What happens in epimerism? Difference is there only at one chiral carbon. When the difference is limited to a single chiral carbon, we call it epimerism. When the difference is limited to a single chiral carbon, we call it epimerism. All right. Okay. Now, epimerism is very commonly asked. What are the classical pairs of epimers? What are the classical pairs of epimers? So here you have to remember certain names which I'll give you. Glucose and mannose will show difference at carbon 2. Glucose and galactose will show difference at carbon 4. All right. So glucose and mannose are epimers of each other. Glucose and galactose are also epimers of each other. Glucose and mannose are epimers of each other. Glucose and galactose are epimers of each other. What is the relationship between the mannose and galactose? Relationship between mannose and galactose. Are they epimers of each other or not? Are they epimers of each other or not? Where did we go? Okay. Glucose and mannose, are the epimers of each other or not? Anyone? Are they epimers of each other or not? I'll have to shift my table a little bit for the charging thing. Okay. Just bear with me for a second. Okay. Very good. Very good. So, like you have guessed correctly, You have guessed correctly. They will be different at two carbons. They will be different at two carbons, at carbon 2 as well as carbon 4. So they will not be epimers of each other. Mannose and galactose. Mannose and galactose are simply diastereomers. They are simply diastereomers. So I'll describe the diastereomerism once again. See, in enantiomerism, we had seen the difference is there at all of the chiral carbons. All the chiral carbons we had seen were different when we're talking about the enantiomerism. But if even one chiral carbon is similar, see here, one chiral carbon is similar. The remaining are different. This is different, this is different, this is different. So obviously they are not enantiomer. So we call them diastereomer. If I make a change so that we have similarity at another chiral carbon and still two of them are different, that will also be diastereomerism. If I make them similar at three and still one is showing the difference, they will still be diastereomers. So basically the difference is there, but some chiral carbon are similar. So both, we see both the things in terms of chiral carbon. Some are similar and some are different. That is when we call them diastereomers. So diastereomerism is showing difference in orientation, but not at all chiral carbon. Okay. In that, we had said there is a special subtype which is the epimerism, where only one chiral carbon is affected, and the classical pairs of epimers are glucose and mannose and glucose and galactose. Glucose and mannose show the difference at chiral carbon 2. Glucose and galactose show the difference in chiral carbon at carbon 4. Remember, mannose and galactose are diastereomers but not epimers of each other. They are only diastereomers, they are not epimers because they differ at carbon 2 as well as at carbon 4. Now before I go to anomerism, I'll quickly talk about the ring structure because we had said anomerism is seen only in the ring structure. So we'll quickly do the ring structure and then we'll come back to anomerism. So I'll use this structure only. Okay, I don't need both the structures, I need only one. Great. Okay, so as you can see, I have drawn glucose here. Now, as long as the molecule is in the dry form, it is in the crystalline form, they are linear. They are linear. But if you put the monosaccharide in water, almost all of them will cyclize. Immediately it will cyclize. 99.7% of the monosaccharide will immediately cyclize when you put it in water. Why does it happen? When you put it in water, the carbon 1 which carries the functional group, carbon 1 which is carrying the functional group, comes close to carbon 4 and carbon 5, and because carbon 1 is having the functional group, it is able to react with carbon 4 or carbon 5. One of them will be involved in bond formation. One of them will be involved in bond formation with the functional group, the aldehyde group. Okay, depending on which carbon is involved in bond formation, obviously we'll get two different forms. We'll get the two different forms depending on which carbon is involved in bond formation. Suppose the oxygen of the functional group, which is attached to carbon 1, which is attached to carbon 2, which is attached to carbon 3, which is attached to carbon 4. Here the oxygen comes and gets attached. Now carbon 4 is also attached to carbon 5, which is then attached to carbon 6. This structure that you see is known as the furanose form. How to remember? F for 5, F for furanose. You can see inside the ring there are 5 members, 4 carbon, 1 oxygen. So 5 membered ring is the furanose form. The 5 membered ring is the furanose form. F for 5, F for furanose. The second alternate possibility was it reacts with carbon 5. In that case, what happens? See, the oxygen attached to carbon 1, which is attached to carbon 2, which is attached to carbon 3, which is attached to carbon 4, which is attached to carbon 5, and this is where the oxygen will come and get attached. Carbon 5 is also attached to carbon 6. Okay, now this form is known as the pyranose form. This form is known as the pyranose form. Remember, the pyranose form has the 6 membered ring. Pyranose form has the 6 membered ring. So when you're talking about the ring isomerism, when we are talking about the ring isomerism, we have two forms, the furanose form and the pyranose form. I hope this ring isomerism is clear to everyone, because if ring isomerism is not clear, we cannot go to the anomerism. I hope the ring isomerism is clear to everyone. We have the ring. Depending whether we get the 5 membered ring or the 6 membered ring, we get the furanose form or the pyranose form. Whether you get 5 membered or 6 membered depends on where the aldehyde group is reacting. If it reacts with carbon 4, you get the 5 membered ring. If it reacts with carbon 5, you get the 6 membered ring. One of them will always be oxygen. Okay? Is the ring isomerism clear to everyone? Now, if the ring isomerism is clear, now we can move on to the anomerism. We can move on to discuss the anomerism. No questions, I hope. Okay, so let's move on to the anomerism. So what is happening when we are completing this bond? Let's say the reaction is occurring. Let's say the reaction is occurring at carbon 4. So what will happen? Oxygen, which is attached by a double bond with carbon 1, will open up one of its bond, and this bond will now be formed with carbon 4. Result: one of the valencies of carbon 1 is now free. One of the valencies of carbon 4 is now free, and the hydroxyl group, which was displaced from carbon 4, will come and get attached here. I'll repeat what has happened. The oxygen which was there in the aldehyde group, it was having double bond with the carbon. One of the bonds will open up and it will go and attach with carbon 4, from where the hydroxyl group is displaced. The displaced hydroxyl group, the displaced hydroxyl group, I'm sorry, the displaced hydroxyl group will come and get attached at carbon 1. Alright, now what happens? Look at carbon 1 now. One valency occupied by hydrogen, one valency occupied by oxygen, one valency occupied by hydroxyl group, and one valency occupied by the rest of the molecule. Can you tell me whether the carbon 1 is still non-chiral or it has now become chiral? Is carbon 1 still non-chiral or it has become chiral? In the ring structure, is carbon 1 chiral or non-chiral? What is the nature of carbon 1 in the ring structure? Very good. So now you understand, as soon as you form the ring structure, carbon 1 will become chiral. And the orientation of hydroxyl group, orientation of hydroxyl group is used to describe two anomeric forms, the alpha, the alpha and the beta forms. The two anomeric forms are the alpha and the beta forms. So when we are talking about the bonds in the disaccharides, I was repeatedly saying the alpha 1,4 linkage, alpha beta 1,4 linkage. So that alpha and beta relates to the hydroxyl group orientation at carbon 1. I'll show it with the help of a diagram, a three-dimensional diagram. Take a look at this phone. Imagine that this uh, phone is the ring. This phone is the ring. You can see four ends are there. Let's assume these are the four carbons. Now, at carbon 4 or carbon 5, the remaining carbon is outside like this. Whether it is one carbon or two carbon, they are outside like this. And at carbon 1, now the hydroxyl group has come and gotten attached. There are two possibilities. The hydroxyl group is on the opposite side. It is on opposite side in comparison to this spoon that is here. In comparison to the carbon outside the ring, the hydroxyl group is on the opposite side. It will be alpha form. In alpha form, the carbon outside the ring and the hydroxyl group at carbon 1 are on opposite sides of the ring. If they are on the same side, we call it the beta form. If they are on the same side, we call it the beta form. I'll repeat. If the hydroxyl group at carbon 1 and the carbon outside the ring are on opposite sides, alpha form. If hydroxyl group at carbon 1 and carbon outside the ring on the same side, it is the beta form. Alright, most of your books will describe it as the hydroxyl group above the plane of the ring and below the plane of the ring. Remember, in that case, the reference point is that the carbon is above, the carbon outside the ring is above the plane of the ring. Okay, so always you compare it with the carbon which is outside the ring. So if they are on the same side, we will call them the beta form. If they are on the opposite side, we'll call them the alpha form. This is the anomerism which is seen. All the bonds will be formed in the biological system. In biological system, we will have water. So all bond occurs in the ring form. Please understand, in biological system we have water. So the monosaccharides will be in the ring structure. In the ring structure, when they form the bond, we will have the alpha beta orientation. So that is why whenever we describe the linkage, we describe the alpha orientation or the beta orientation. It tells us how the hydroxyl group at carbon 1 is oriented before it forms the bond. So this summarizes our isomerism. I'll quickly go back to the isomerism where I had shown the summary, and we'll see. I had said the isomerism is of three types. The isomerism is of three types. We have the stereoisomerism, we have the ring isomerism, and we have the functional isomerism. The stereoisomerism can be of three types: enantiomerism, which is further of D and L forms; the diastereomerism, where we have a special subtype, that is the epimerism; and the anomerism, which is also of two types, alpha and beta subtypes, which is also of two types, the alpha and beta subtypes. Remember, anomerism will be seen only in the ring structure. Anomerism will be seen only in the ring structure because in the linear form the carbon 1 is not chiral. In the linear form the carbon 1 is not chiral, so in anomerism can be seen only in the ring structure. In the ring isomerism, we have the furanose form, the 5-membered ring, or the pyranose form, which is the 6-membered ring. Lastly, depending on the functional group, the molecules may be the aldoses or they may be the ketoses. If the aldehyde group is there, we call it aldose. If the keto group is there, we call it the ketose. Okay. In this case, the structure which is above the plane of the ring, I'll denote it with a thick line. So this is oxygen, this is carbon 1, carbon 2, carbon 3, carbon 4, carbon 5. The carbon 5 is linked with carbon 6. As you can see, I've drawn a thick line. So carbon 6 is above the plane of the ring. Carbon 6 is above the plane of the ring. Now, when we talk about the hydroxyl group, there are two possibilities. One possibility, the hydroxyl group is above the plane of the ring. Second possibility, which I'm showing with the dotted line. Dotted line means the hydroxyl group is below the plane of the ring. So the standard position of the ring is the carbon outside the ring is above the plane of the ring. Okay, the carbon outside the ring is above the plane of the ring, and if the hydroxyl group is above the plane of the ring, beta form. If it is below the plane of the ring, it will be the alpha form. I hope this makes it more clear how we describe the alpha and beta isomers, the anomers. So in this case, what you find, the carbon 6 and hydroxyl group, they are on same side. Yeah. They are on the same side. But in the second scenario, in the second scenario, they are on opposite sides of plane of the ring. I hope this clears it up a bit more. If it is still not clear, just let me know. I'll take some 3D structure and then I'll try to show you. Yeah, thank you. Thank you. Thank you. Thank you. So I hope the isomerism is clear to everyone. Isomerism is a very important topic. Almost every time you're going to get a question from isomerism. It is one of the most commonly asked topics from the carbohydrate chemistry. Any questions so far? Because this is where we are going to take a break today. Tomorrow we'll start again. The time will be given to you by Dr. Manoj. Sir will decide at what time we are going to start tomorrow. So this is the place where I would take a break now. But I'll wait for your questions. If you have any doubts, any points you want me to discuss again, then please feel free to ask. I'm here for you. I'll wait for another 5-10 minutes. And if you have any queries, I'll take them up. If you have any queries, I'll take them up. Okay, diastereomer, anything else? Alpha is opposite side. Same side is beta. Same side beta, opposite side alpha. Okay. Now I am going to give you four scenarios, and you have to tell me which one is showing enantiomerism and which one is showing the diastereomerism. So we have two molecules, molecule A and molecule B, and we are describing the orientation of the chiral carbon, carbon 2, 3, 4, and 5. For A, I have already described what is the orientation of the hydroxyl groups. On carbon 2, it is on the right side. In carbon 3, it is on the left side. In carbon 4, it is on the right side. In carbon 5, it is also on the right side. Now let us look at the orientation of the chiral carbons in molecule B. Left, right, left, left. So label this as question 1. What is the answer to question 1? Are we seeing enantiomerism? Are we seeing diastereomerism? Question 1 answer, are we seeing enantiomerism? Are we seeing diastereomerism? So enantiomerism is clear to everyone. In question 1, all chiral carbon have opposite orientation. Therefore, enantiomerism. Let's go to question 2. Let's go to question 2 now. Let's go to question 2 now. Okay. In question 2, this is right. This is also right. This is left. And this is right. Okay, what about question 2? Enantiomerism, diastereomerism. Enantiomerism or diastereomerism? Okay, okay, very good. So, what you find? What you find? Same, different, different, and same. Are all different? No. So it cannot be enantiomer. All right. Is difference there at more than one carbon? Yes, difference is there at two carbons. So it cannot be epimerism. So the answer in this case is difference at two chiral carbon, therefore diastereomerism. Right? Last, right, left, 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 right, 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 right. So that's question number 3. Now what is happening here? Enantiomerism, diastereomerism, epimerism. What will you write it as? Okay. Others, what about others? Murtaza and Simha have given the answers. What about others? Great. So I think it clears it up. In this case, what is happening? The difference at only one chiral carbon. The difference at only one chiral carbon, and therefore what we are looking at is epimerism. What we're looking at is epimerism. So I hope the enantiomerism, diastereomerism and epimerism part is clear. Now we'll see what all other questions are have been requested. So we'll try to take them up. Okay. Epimerism, glucose, mannose, glucose, galactose. Once complete concept, please explain. Okay. So now see what is happening. We are seeing the difference at carbon 2. We are seeing the difference at carbon 2. I told you in the beginning that A that I have drawn is glucose. Now if all the other structure is same but orientation of hydroxyl group at carbon 2 is opposite, then this new structure must be mannose. Then this new structure must be mannose. So glucose and mannose are similar at all places except orientation at carbon 2. Formula for the isomers will be the same. There is no difference in formula in any of the molecules. What is the difference? The difference is in the orientation. So if the difference in orientation is there at carbon 2, then the molecule is no longer glucose, it is the mannose molecule. Similarly, if the difference were there not at 2 but at 4, the difference were there at 4. In this case, this molecule would be galactose. Now the difference is there at carbon 4, not at carbon 2. So this is the galactose. Rest of the structure is same, exactly same as glucose, but a difference in orientation at carbon 4, that will be galactose. So I hope the glucose mannose, glucose galactose pairs are clear now. Any other question that we have? Functional isomerism. Okay. Yes, glucose and mannose are epimers. Glucose and galactose are epimers. Now let's talk about the functional isomerism. Let's talk about the functional isomerism. Questions, I'm केवल questions कर रहा हूँ. Okay. So functional isomerism. See, in the other isomerisms, what is happening? The formula same, groups same, orientation is different. This is what we see in stereoisomerism. All right. But when we talk about functional isomerism, formula is same, but groups are different. This is the functional isomerism. We had given the example here of glucose and fructose. Now see the formula of glucose, C6H12O6. Formula of fructose, C6H12O6. What is difference? In glucose we have aldehyde. Aldehyde means at carbon 1 we have the double bond, right? In fructose we have the keto group. This means at carbon 2 we have the double bond. So the functional group is different in the functional isomerism. The formula is the same, but the functional group is different in the functional isomerism. So that is the basic fundamental difference. Any other question? Any other question before we close the session for today? Any other question? I'm waiting for your questions before we close this session. Any other question from whatever we have discussed today? We talked about the carbohydrate chemistry and we've talked about the isomerism. So classification isomerism, anything you want to ask? Any questions? Any questions? Okay, if there are no more questions, I think we'll close the session for today. Thank you very much for listening so attentively and participating so actively in the class. I appreciate your efforts that you have put in, sitting right up till 11 o'clock and paying so much attention. We are going to have about 4 more days of class and we'll try to finish your biochemistry in a very good manner. We'll try to cover all the questions and please feel free to give discuss any doubt that you have in the session. Please use the chat system and best of luck. Take care. Stay safe. Good night.